I will now try to get in touch with WHO Director General Dr. Tedros. Joint mission with China on. I'm glad to say that the WHO-led joint mission with China on COVID-19 is moving forward. We expect the full team to touch down over the weekend. The mission consists of 12 international and WHO experts and a similar number of national expert counterparts from China.
I have a very fast two-part question. Can you enlighten us on the 12?
Our understanding is that the cases amongst health workers peaked in the 3rd and 4th week of January, and there's been a rapid fall-off in the number of cases that have occurred in health workers in the last 2 weeks. This may reflect increased levels of training, increased levels of protection, and also increased levels of awareness. Remember, this outbreak has expanded very quickly in an unsuspecting health system, so we also need to look at how many of those health workers were exposed unknowingly within a clinical environment, and how many were wearing protective equipment, how many had training. There's a whole load of factors we need to look at.
Really quickly on Christiana's question about the Olympics, because that is a major concern. And
we have not offered advice to the IOC for the Olympics one way or the other, and neither would we. It is not the role of WHO to call off or not call off any event. It is the role of WHO to offer technical advice, to support a considered multi-layered risk assessment around the event, to offer advice on risk reduction and risk mitigation measures, to offer advice on risk response measures, and it is the decision of hosting countries and the organising agencies to make that decision. So let me be clear, and we are continuing to do that. With regard to the international team, I believe we will have US experts on that team, so we will have to wait and see. So let's see what the next few days and weeks bring.
In the response to this virus, I'm just wondering, do you think there have been any mistakes at any level?
We need to balance the health and welfare of the people on that ship, and they are from many nationalities, against the obvious need to prevent any further spread within the Japanese community. And I think the Japanese authorities, I hope, will find the right balance between those two things. We trust through our discussions with them that they are beginning to see that we have to make some arrangements, especially to take care of the more vulnerable people on that ship, especially those who don't have access to appropriate ventilation, etc.